Following the examiner's pre-cycle meeting, examiner pairs must have time to review and discuss the patients that will be participating in the assessment. This process, known as calibration, is essentially a standard setting process and is critical to the fair and consistent conduct of the assessment. It is recommended that examiners at stations 1 and 3 see and examine patients alone, ideally without first reviewing the clinical information provided, thus seeing the case from the candidate's perspective. Candidates should be judged on their ability to detect what an examiner detects and make diagnoses that an examiner would make. In addition to checking physical signs, take time to ensure that patients understand what will happen during the examination and that they know that they will have the opportunity, after each candidate leaves, to clarify anything a candidate may have erroneously stated about their own condition or problem. Position and expose the patient in a way that will help the candidate and ensure the introductory statement or case descriptor provided by the host team directs the candidate appropriately. If it requires clarification, ask for it to be changed. At stations 2 and 4, it is recommended that the surrogate is rehearsed, with one of the examiners taking the role of the candidate, and that specific aspects of the scenario that require clarification or emphasis are discussed. Additional information may need to be added to the history, and if the surrogate is required to ask questions of the candidate, these should be clarified. The subsequent calibration discussion should focus on agreeing the clinical signs or symptoms that are present and considering together what specific criteria will be used to judge whether the candidate can be awarded a satisfactory mark in each of the skills assessed. The calibration process takes 30 to 40 minutes and should always be completed before the examination starts. We will return to calibration during the discussion of the changes to PACES.